There are many reasons that someone may have an appointment with a genetic counselor. You may have a personal history or family history of a genetic condition, birth defect, chromosomal disorder, or hereditary cancer. You may want testing or more information about genetic conditions that occur with higher frequency in your ethnic group. You or your partner could have had ultrasound examinations or blood testing that indicate your pregnancy may be at increased risk for a certain complication or birth defect. Or you may be concerned that your child has developmental delays that may be due to an inherited disorder or birth defect. These are just a few reasons why you may see a genetic counselor. Through this video, we will show you what happens during a typical genetic counseling appointment and what you can do to prepare. A genetic counselor provides information, offers support, and addresses any specific questions and concerns that you might have. One of the first things that a genetic counselor will do is discuss the reason for your referral.
So Gina, you're here because your family doctor, Dr. Patel, referred you to genetic counseling?
Yeah, that's right. I was thinking about starting a family soon, but I was worried because my sister just had a child who is diagnosed with cystic fibrosis.
Okay.
After discussing the reason you have been referred to genetics and answering any questions you might have off the bat, the genetic counselor will ask you about your medical and family history to help determine whether a condition has a genetic component.
Gina, you said you have two sisters, one who is 29, one who is 27, and they both seem healthy?
Yeah, that's right.
Okay, I'm glad to hear that. And which sister had a baby with cystic fibrosis?
That would be Karen, the 29-year-old.
Okay. And baby girl or baby boy?
Baby girl.
Baby girl. And how old is she now?
She's about 6 months now.
6 months, okay. And how are they doing?
They're doing well.
Good.
I think it was hardest when she first got diagnosed.
Sure.
But we're adjusting pretty well, better than I expected. So yeah.
Good. I'm glad to hear that. Having a new diagnosis of cystic fibrosis can be quite challenging, but with the technology today, babies and adults can live with cystic fibrosis and have full lives. So I'm glad to hear you're doing well. Do you know much about cystic fibrosis?
No, not really,
Okay.
other than what I've observed in my niece.
Sure.
And I've noticed that she has difficulty breathing most of the time.
Yeah, that is a common symptom. So I'll finish taking your family history, then afterwards I can go into more depth about what cystic fibrosis really is.
Okay.
The genetic counselor will ask you for information about your siblings, parents, aunts, uncles, grandparents, and even cousins. It is a good idea to try and gather this information before you meet with your genetic counselor. It is also important to note that things you may not think would be relevant, like asthma, early deaths, anyone born with a complication or birth defects, or fertility issues. And if available, bring in any results of any genetic tests you have previously had, as well as the results of genetic tests your family members have had. Typically, the more information you can provide the genetic counselor about your health and the health of your family members, the better. Next, if there is a genetic condition diagnosed in your family, such as there is in this example, the genetic counselor will explain the condition to you and how it is inherited.
Cystic fibrosis is an inherited condition, which means it is passed from parent to child through genes. Genes are the blueprints of life. There are approximately 25,000 genes in the human body, and almost all of these come in 2 copies. You have one copy from your mom and the other copy from your dad. So things like eye color, hair color, the shape and function of your heart are all determined by your genes. Sometimes there could be a spelling mistake in the gene, preventing the body from being able to read that gene and know what it's meant to do. These spelling mistakes are called variants. Any questions so far?
No, I'm following you.
Okay, good. So when this happens, when a variant happens, it can lead to health problems or increase your risk for certain genetic conditions. Cystic fibrosis occurs when there is one of these variants in a gene called CFTR. So normally, this gene allows a slippery and thin mucus to be produced, which coats and protects parts of the body. But when you have cystic fibrosis, that means that gene isn't working properly, and it results in a mucus that is thick and sticky, and it builds up in the lungs and digestive system, and that can cause problems for how you breathe and digest food, similar to your niece.
After you feel comfortable with the information that the genetic counselor has provided you, and after all your questions have been answered, the genetic counselor may be able to calculate your risk for having the genetic condition.
So here we have your family tree, which can also be called your pedigree. So this is your niece who has cystic fibrosis, and she has 2 non-working copies of that gene we talked about. And then your sister, which is your niece's mom, probably also has 1 non-working copy, and the other non-working copy came from your niece's father. So your sister, having one non-functional copy, got that either from your mom or your dad. And we can likely say it's probably your mom because your mom's sister also has cystic fibrosis.
Okay.
So knowing that your mom has one working copy and one copy that doesn't work properly, that's a 50% chance that you either got the working copy or the non-working copy from your mom.
Whoa.
So you have a 50% chance of being a carrier of cystic fibrosis.
The genetic counselor is trained to provide guidance and emotional support as you learn all this information. They can also then help you understand what tests are available, what those tests may show, and provide guidance to help you decide whether testing is something you would like to pursue. A genetic counselor helps each person make informed, independent decisions about their healthcare and reproductive options. They will respect each person's individual beliefs, traditions, and feelings.
So Gina, after everything we've talked about today, do you think you'd want to know about your options for genetic testing?
No, I think I'm not ready for this right now.
Okay, that's perfectly okay, Gina.
Now remember, these are just some of the most common points of a genetic counseling appointment. Each appointment will be unique to the individual's concerns and decisions. For more information, please refer to the following links.